Welcome to ADACAM's Nursing Conferences. This is a series of online education that is offering nursing contact hours. This online program has been approved for one contact hour. ADACAM is an approved provider of continuing nursing education by the Pennsylvania State Nursing Association, which is accredited by the American Nurses Credentialing Center Commission on Accreditation. ADACAM nursing contact hours are acceptable nationwide for licensure renewal. You will be required to watch the voiceover PowerPoint and then take a 10-question post-test where you must obtain a score of 70%. You can take the exam as many times as you want if you fail. After successfully finishing the exam, you will be asked to submit a short survey, and then your certificate will be printed on the screen as a PDF document that you could either save or print.
Psychology, immune system, and neurology, and the connection between each of them and the components and how it interacts within the body, the brain, and our wellness. The objectives for this lecture are: what is PNI? What is PNEI, which is psychology, neurology, endocrinology, and immunology, and why we look at PNI, what are stress factors in sickness, immune response and inflammation response, mood swings, the mind-body medicine, epigenetics, power of sleep, a quiet environment, ways to use in your nursing and medical practice, literature review, resources. PNI, PNEI. They're very long words, so for most of this lecture, I usually will say abbreviate them to PNI, PNEI. So PNI is the study of the interaction of the nervous system and the mind body as it relates to the immune system, and these are emotions that affect the immune system. This technique is a way of bringing all different fields of psychology, neurology, immunology to study the relationship between each other. Before, there was the theory that they were separate. Now PNEI, as we talk about these lectures further, they are kind of intertwined. So it's psychology, neurology, the endocrine system, and the immunology, the immune system. So the study of the interaction of the mind, nervous system, endocrine system, and immunology. These were founded by Dr. Adler and Dr. Michael Cohen. Dr. Adler was the first experiment has been done since 1975, and it affected the immune system. And Dr. Cohen is a microbiologist and immunologist, and they have written many papers in this theory and studies, and through the years it has been progressed and more research has been found. But it has been around actually since the 1970s. So why do we consider PNI, and why does it matter? So majority of the time, somebody may say, why does it matter? But when you really look at the connection of it, we keep thinking that our body is separate systems, and they're really interconnected. And the importance of this is that when you think about illness and you think about our body, when you have high stressors or sickness, they all can affect different parts. You can become more nervous, more anxious in the nervous system. The endocrine system, you can have high sugars, low sugars. You can have tired, fatigued, sweating. Like the response can be high or low, and that connection all in turn affects your health. So you can be super healthy and optimal, or you can be low. and you don't see the connection early on, or at least observe the triggers, you may never be able to get out of that cycle. So does it really matter? I truly believe it does. PNI, once I understood kind of what was going on with my health and my body, I realized I had to empower myself to learn ways to, daily ways to triggers that I have or things that come up so that I could be healthy. It's a process. It's a 1 day, 2 day, every day. You need to do something. And so it's not just all right, here's a quick fix. And that's what a lot of healthcare does now. It's just a quick fix. And really the research and these studies, why they're so important, is that our bodies and our health, mind, and connections, we need to develop ways to be healthy from the inside out. And this is a example of studies doing just that. Stress and PNI, and how does the body respond? So the stress response is when you see here, your body has neurotransmitters, and some of the neurotransmitters are dopamine, epinephrine, serotonin. In the body, when your body is stressed out, anxious, it will release these neurotransmitters, which then will cause the body to increase like a fight or flight or response to heal, fix, get to. And that is where these macrophages, that's in the first defense, and we'll talk about that further, the different types of immune response. And in the innate response, the macrophages will say, oh, I have to fix this. I have to fix the body. We're super stressed. We need to do this. And what it does is that releases these cytokines. And these cytokines will then affect the body with either increasing inflammation, trying to work the heart. It may affect diabetes, osteoporosis. Things come up where it then decides, I need to fix. The stress responses are important because what it does is it shows the relationship between stress, the time, and the immune response itself. And with all of these different studies, it's understanding how our behavior and what the stress response that we have can really affect our overall chronic illness and immediate illness. What is psychoneuroimmunology? This is just another slide depicting and discussing a way of showing the framework on how it interconnects within the body and the endocrine system. You'll see here to the left is the framework and the PNI as it kind of builds up the branches within the body. And on the right side is the middle is the stressors that are affected, and within the nervous system you've got stressors that affect the anxiety, depression, insomnia. They release neurotransmitters, then that may go to the endocrine system, which may release or decrease the amount of hormones that are released. In the endocrine system you've got the thyroid and the adrenal and the gonads, and how much will be affected, whether it's an increase or decrease. When you look over to the immune system, there's that interconnection of hormones are released or decreased, and then you may have an increase of cytokines within the body. Over to the right, you'll see the nervous system, the neurotransmitters increasing and decreasing, and that's the effects in the body are like inflammation, infection, allergy, and pain. So in the previous slide, we were talking about the interconnection of the nervous system, the endocrine system, and the immune response. We discuss the endocrine system in response to how will it cause a fatigue. So one element we're discussing here is when you have a high amount of stress, this may cause on the adrenals, which is above the kidneys, chronic fatigue syndrome. The connection that we were discussing is the hypothalamus, which is in the brain, pituitary, which is in the brain, and then has the adrenal axis. And this activates a stress response, which we showed before as the stress response and how they're interconnected. To the right of this PowerPoint, you'll see that there's different types of adrenal fatigue, or shall we say adrenal burnout. You can consider adrenal burnout to manifest within the body and within your life different ways. One way, you can be considered wired for sound, meaning you have high amounts of cortisol, but high amounts of neurotransmitters. This happens and you're considered kind of the superpower, like you look like you've got everything made, you got it all situated, you got it all figured out, but then you come to the point where you crash. The second type is considered wired and tired. High amounts of cortisol and low amounts of neurotransmitter. This is things like you have a lot of sinus infections, you have a lot of allergies, hay fever, tiredness, and infections. Your immune response has then been depleted. Adrenal burnout number 3, wired and tired. This is a low amount of cortisol and high neurotransmitters. These are people that may be pretty good moods, but they have a large amount of inflammation within the body and pain. Now, just plain tired. That is a pretty common one, and that's when you have a depletion of your cortisol as well as neurotransmitters. So not only maybe you be depressed, but you might have been anxious, crashed, and you also have low cortisol, which means you have not much energy. So in this situation, you're getting more critical because the less neurotransmitters and the less of your cortisol, you become more and more depressed, or you become more and more sick, and the body eventually just wears out. So PTSD and the PNI system. So we just talked about adrenal fatigue and the response it has on the body. Now, pretty interesting research has come to show that when they did a lot of studies with PTSD for military members and for trauma victims, that's when they were able to see the interconnection more so with the immune response and the body due to these events. Now, PTSD is a debilitating mental illness with physical, psychological events that may cause a person fear, anxiety, vigilance, and flashbacks. There's long-term chronic effects on the body and chronic conditions. PTSD can show links between the immune function response and links to the psychological and immune system. Hence, this is where the PNI connection comes from. So in these instances, these extreme cases help understand why PNI is so important. In my own situation, I was a PTSD victim, military, and I knew that I had to find other ways to get better because I was struggling. So for me, PNI and the study of it is just so interesting that I wanted to understand how could I do things to make my life better and healthier. And I really hope that you find ways for yourself to do this too. So stress response in the body and the immune system. Like we were talking again about PTSD causes an exorbitant amount of stress. And within the mind, you have a behavior, awareness, and consciousness. But when it is triggered or altered, your physical, psychological stress may change. Your neurochemicals within the brain, the neurotransmitters, will be altered. And your environment, if that changes, or your body's health changes, then your immune response, the endocrine, metabolic, and genetics may also change. This is why this interconnection is always so important to understand, because everything in which we go about our day and in life has in a sense, a cause and effect, but can be decreased or improved. So what is the immune response? So there's two different types of immune response. There's the innate response within the body and an adaptive immunity. Innate response is the first line of defense within the body that responds to like a foreign object, a pathogen, or something that the body does not recognize. And this is like the immediate response. It then will bring out monocytes, macrophages, neutrophils, basophils, and eosinophils. These are white blood cells to fight the foreign inflammation or infection. A monocyte and macrophages activate the neutrophils to perform they call phagocytosis to help destroy or engulf the pathogens and release cytokines within the body to help fight off the infection or such. A neutrophil is a large band in the beginning and the site of infection to engulf the microbes. Basophils or histamines are pro-inflammatory response, and the eosinophils are those allergic response within the body. Immune response. The second type of immune response is called adaptive immune response. It's a delayed response or prolonged response within the body. And after the creation of antibodies, the white blood cells target specific antigens. Two types are lymphocytes are called T and B cells. The T cells are destroy memory T cells, and they are the helper cells. So they are the ones to help fight the infection. Now the Bs are released the antibodies which the body has created in a fight or foreign antigen. And the B cells are also known as memory cells. And remember, they are the certain ones to fight certain infections. So they remember what they need to fight, and they remember that they have to, if the foreign infection comes back again, they remember how to fight it off. In the body, you have an inflammation response in addition to an immune response. So it is still a response to the body's fighting something, but in this aspect, it instead of just fighting off an infection, it brings on an inflammation to a localized area to help promote healing. Now there's two different types of inflammation, and majority of the time you're hoping you're more in that acute phase and where you have a progression of healing. And these types are a cut, a trauma, basic allergen exposure, and an initial infection. So types of fixing this is basic infection. You may have sunburn, an allergic reaction, anaphylaxis to some sort of peanut or allergen, trauma like a bruise or a sprain, broken bone, a cut, a stab, frostbite, and maybe a chemical irritant. And in these scenarios, your body will respond to help heal, fix, and change the dynamics within the body to help with the progression of healing. Now, what we talk about mostly with the connection of the body's response is this progression in destruction. So it's almost the sense of when you have these triggers or an excitability of the immune response, it then causes excess inflammation and cytokine production to then bring on these illnesses. And types of illnesses that are related to excess inflammation within the body may affect and are part of the cardiovascular system, autism, rheumatoid arthritis, autoimmune, neurology, Alzheimer's, and cancer. Inflammation in the body presents in different types of disease. And this is just an example of different possible infections or disease that inflammation is a factor. So in the brain, you can see multiple sclerosis, PANDAS, Guillain-Barré, and the thyroid, Graves' disease, Hashimoto's, lung, you've got sarcoidosis. In the liver, autoimmune disease. Kidneys, liver, lupus, muscles, myositis is inflammation of the muscles. In the skin, psoriasis, alopecia, vitiligo. In the eyes, you've got uveitis, which is the inflammation of the uveas, and the menieres in the ears. Blood, you've got hemolytic anemia, neutropenia, thrombocytopenia. In the heart, cardiomyopathy. Joints, RA, juvenile arthritis. Blood vessels, vasculitis, temporal arteritis. So there's a variety of things that the body has causes these responses. I mean, some of it is genetics, and some of it is a response to health and what we have done to decrease or increase. So there's ways some of this can be managed a lot better. PNI and the stress research developments. So what has been changing through the years, and where is the research going to implement to increase more things that are coming about? So there's 3 phases of this. In phase 1, it's been the 50 years of research and understanding the brain-body connection. Phase 2 are clinical trials that are showing the cognitive behavior therapy and mind-body therapy, such as mindful-based stress reduction, and the benefits of each of these that help decrease and increase health response for more optimal health. And in phase 3, it shows that they're trying to go in the direction of getting randomized, controlled trials to help influence the stress response in chronic illness and build on the connection between the PNI in the body. Steps to decrease the immune response disease. So the process of getting that immune response where things may come up as a disease or be triggered. Now, these are just 9 steps that were discussed by the Dr. Hyman. You can get on his website, and he's a functional medicine doctor and pretty famous. And these are just different things that he has found that helps decrease the response. So one is check to find the hidden infection. See what's going on. Is it yeast? Is it candida? Viruses, bacteria, Lyme? Work with your doctor to help fix this. 2, check for hidden food allergens. You may need testing. Are you sensitive to certain things? Look for celiac, things in the bloodstream. Check for heavy metal toxicity. A big one would be fixing your gut. So things on irritable bowel syndrome, use of probiotics. Number 6, fix nutrients in the body. You might need fish oil, vitamin C, vitamin D, probiotics, I'm a big fan. Help calm down that immune response in a natural way. Exercise regularly, natural anti-inflammatory by building up the circulation. Practice deep relaxation like yoga, deep breathing, biofeedback, massage. These all help decrease the stress, because when you have high stress, like we said before, increases the immune response. 9, tell your doctor or maybe see a functional medicine doctor. Encourage them to learn more about functional medicine, and if not, look up books yourself and meet and look for those type of doctors. When we're talking about stress markers, and we're talking about stress with the PNI system, one way to measure this is the salivary glands. So your spit has enzymes in it, and there's 2 biomarkers and a couple biomarkers that can be used to check the levels. And you can use amylase and saliva to look at the cortisol levels within the body. And this will give us an indication of if we are in high stress, in increased inflammation within the body, and how it is affecting us. So it's really neat for when there are more studies going on and there's an increase of or wanting more scientific studies to measure stress, the saliva is one way of doing this. As spoken before, stress in the PNI system, it is associated with the adrenals and also a hormone called cortisol. In the body and the correlation to the PNI system, the hypothalamus in the brain and the pituitary and the adrenal glands, those three are correlated and they call it the hypothalamus pituitary adrenal axis. And in this, it's regulated and balanced. All the hormones are nicely imbalanced. When it is off, sometimes you'll see an increase in your cortisols and a decrease in the adrenals, and you'll be very tired or chronic fatigue. And what the saliva enzymes are showing is that it can see a high pattern, like when you're in the morning and you first wake up, you might have energy. If you sleep well and have a good night's sleep, your cortisol levels will be nice and high. And then around 3-4 o'clock, they'll start to plateau, and that's kind of when you want that afternoon coffee, afternoon snack and such. So what the enzymes will show is that if there is an irregular pattern, it will see that things need to be adjusted, and that our thoughts, our patterns, and our behavior has changed. And it's just the saliva enzymes are just a way of kind of measuring this, and it's a good indication to help scientists and psychologists to get an idea of what is going on with their patient or their clients. So to figure components of measurement to help improve. It's just another way of like, kind of in a sense, we have vitals to check your heart rate and your blood pressure. If this was off, it definitely gives us an indication, because sometimes someone will say, oh no, I'm not stressed, I'm not tired much. And then you do some type of test like this, and it actually shows that the body really is in extreme stress, chronic fatigue, and like an adrenal syndrome. So that it's just a nice indicator of seeing that. The PNI system, and how can it relate to your gut and your stomach issues? They call it the gut microbiome. So within the gut, you have bacteria, microbes, and different cells and enzymes that help absorb your food, break up your food, and help bring and pass it through the body to give you nutrients and such. And back in the day, they had thought in history that the microbiome, or the gut and bacteria within the body, had been, shall we say, bad. Any type of bacteria within the body was always considered not good, and that we need to eradicate it. So a ton of antibiotics and medications were given and had killed, now we know, as good and bad flora. So sometimes in the body we do have this good flora that is needed and necessary, and we also have the bad flora that's needed and necessary. And it has shown that when we eradicate all flora, or these microbes, it does have an effect on our overall brain and gut wellness. The gut microbiome is a complex ecosystem of bacteria, microbes, consisting of peptides, fatty chains, vitamins, and even neurotransmitters from the brain exist in the gut microbiome. The gut microbiome is connected to the immune system, brain, and as we had previously spoken, it still does have an effect on your stress. Like people say, I have a pit in my stomach, I don't want to eat, or you may have an overactive stomach problem. Would you believe that the bacteria within the gut for an adult human can weigh about 1.1 kilogram, which is actually 2.2 pounds per adult human. So if you find yourself excess bloated, you may actually be having almost 2 pounds of bloated gas produced from bacteria. Within the research, there has been shown numerous connection and communication between the brain and the gut, and how it has impacted the way we feel, the psychology of like good mood, bad mood, and the brain. A main one that I would say is when you're talking about someone says, I have a pit in my stomach, I really don't want to eat, I'm scared and tired. Well, consider that in the sense of the stress level is super high and your fight or flight has come in instead of the rest and digest. Your body has now stopped wanting to digest your food and has now prevented you from eating. And in the biome of the body, you have now become upset, tired, and now it is only thinking about the stress that has been affecting you, and that is all that it is thinking about doing instead of actually digesting that food. Another aspect that comes in mind when you talk about the gut microbiome is you're discussing how is the actual bacteria within the gut and how is that affecting your body. Now, these so-called good flora, what is that and why do we need to have it within our stomach? There has been numerous studies on, and it's still very much so in its infancy, the microbiome and pre and probiotic discussion. So there has been some information and more research on the effectiveness in pre and probiotics, but the main thing that they're at least trying to identify is very useful flora and how can we add more of that within the body, or see, is this a personalized bacteria implementation, or is this more of everybody has these bacteria within their gut biome, and if you maintain a homeostasis balance, then you should be doing well. Your PNI system and the continuation of how it correlates to the microbiome or the gut microbes in the body. So within initial history, your microbiome, like I had said previous, has been known to be considered harmful. But now, through the years, they have realized that killing off all bacteria within the gut is not the best treatment, and it actually has had previous studies where they have been doing, or actually recent studies where they have been doing this fecal transplant, where they are taking good stomach flora and taking that fecal into pills and actually giving that to patients that have like an ulcerative colitis, irritable bowel syndrome, or severe Crohn's, and has helped them with building up their immunity and decreasing symptoms of this type of diseases. And there has been numerous positive feedback from that. Now, two main microbes that are affiliated and have been known to have a large percentage within the microbiome are called Bacteroidetes and Firmicutes in the adult microbiome. There has been more information on the numerous amounts of microbes that are actually available in the microbiome, but these are two that they found that are predominant in an adult human. More information has come out that the colonization of these microbes are really a crucial part of the immune system and within the body, and it really has helped affect the PNI system in a good and bad way, and that what we put in our bodies and how we treat our stomach's flora has been a correlation to the PNI and our behaviors. Good bacteria have receptors which present to the innate immune system. And because, as we had spoken before, the innate immune system helps with the inflammation response and bringing cytokines within the body. So what the gut bacteria does is it's another way of fighting off infection or decreasing excess inflammation, or it can actually bring more inflammation if you have less good bacteria within the body. So that is a factor. And this, through this different research, has really shown that when you really keep a good gut biome, you really have a better overall health within, or shall we say, optimal health. How can exercise affect the PNI system? And is there a correlation? Well, through the research, it has definitely shown there is a correlation between the exercise that we do and how it affects our brain-body wellness. So in the mind, the body, and the wellness, there is a complete correlation. Not fully complete, there actually needs to be more studies, but there has been shown, even back in the ancient times, that physical activity is part of building up circulation, building up our health, and it does have to deal with how we feel and our mood. Now, physical activity is described as any type of body movements which the skeletal muscles requires energy. Exercise is considered the subcategory of physical activity with a purposeful sense of movement and maintenance within the body. Physical exercise is connected to the PNI system. The PNI shows exercise has been made an interaction, and it does affect the way our psychosocial and our factors are on the immune system and within the body. Exercise has been known to be a great benefit for people and improves overall circulation, overall health, and the recent connection has shown that it improves the body's health system, not only immunity, but its overall mental health. It helps build more positive thinking by decreasing depression and building up emotional health and well-being within a person. The exercise is shown to be a form of positive psychology, and that the physical activity has increased a person's mood, which then has decreased the depression or loss of attitude or effect a person may have, and the exercise has builds them up and gets them moving and gets them having purpose and meaning, and this then in turn helps with their overall optimal health. Exercise within the body and how it has affected the PNI have shown that it does give our body the opportunity to decrease inflammation and decrease the emotional moments and reactivity within the way we are. This meaning there has been a number of cross-sectional studies that have shown that exercise will lower the inflammation and decrease the body biomarkers in depression and in our behavior. Physical activity has been correlated to the positive psychology within the body and then has decreased the inflammation markers within. And it has shown that this positive psychology has then improved our behavior, which instead of turning to alcohol, substance abuse, nicotine, and other drugs, we are choosing to improve our diet, having smoking cessation, and really making better choices in the way we want to live. Exercise has improved the body's immunity, and there has been overall increased evidence which supports by the public health recommendations that physical activity is very necessary for brain body. There has been studies, they say about 5 times a week, 30 minutes a day. Now you can take that 30 minutes and put it into 3 sizable ways of exercising. So you can do 10 minutes in the morning, 10 minutes for lunch, and 10 minutes in the evening. And there you have 30 minutes a day of exercise. So in a way, you've taken these micro bites of physical activity, but you've put it down to 10 minutes. And in that, you've given yourself the opportunity to be a little bit healthier by just doing little micro exercises, shall we call it. PNI and the importance of our sleep. So the brain body wellness is super important in the sense of how we rest our minds. So if we're active 24 hours a day, 7 days a week, and we don't give ourselves the time to reset, renew, and rest, we really will take the time to be overtired, overstressed, and that will contribute to that excess within the body, excess inflammation, excess illness, and it will have a factor on the way we live. I am one that is very active, and I enjoy being active and doing things, but when it comes to sleep, I enjoy sleeping. I am definitely one of those people that doesn't feel like I'm missing out, and I do like to get between 6 hours of sleep a day. If I don't get at least 6.5 to 7, I definitely can feel it, and I'm not the happiest person all the time if I don't. I mean, I try to make the best of it, but I really do feel a difference when I'm more rested and feel like I've gone through the day. And then what it shows is that there really is an interaction between the body and the way we heal and the necessity of sleep. And through the different studies, it has shown that there's an interaction among how we behave, the neural and endocrine system, and that it communicates with our immune system, and that this time of rest actually gives the autonomic nervous system and the neuroendocrine system a time to heal and promote a better quality of health. Sleep has impacted the immune system and will decrease the factors of excess inflammation within the body, excess anxiety, and is a link between the way our neuroendocrine system is and our sleep disturbances, as well as immunity. You hear about this kind of a lot when people are in the ICU, or if they have Alzheimer's or mental dementia, that those individuals that always have a lot of these scatteredness and the thoughts within the head, they have almost like, should we call it a dis-ease within the brain, that they are not able to get some good quality restful sleep. And in the ICU settings, because there's alarms and such, there isn't that quality of healing. And so it does have a factor on where a person's brain pattern and the optimal way of healing. And sleep is just a really important part of that. So power of sleep is another factor in helping decrease the stress response, the immune response, and the importance of sleep is that you should try to get between 6 to 8 hours of sleep. And this has shown through studies that sleep deprivation is a direct correlation to the stress response, increased immune response, and how our body is affected through our health. So please take some time, as much as you can, to give yourself the adequate amount of sleep and some cat naps throughout the day. So the medical and nursing implementation with the use of PNI. So because we discussed on immune suppression and the response to the patient, just like I talked about sleep and the quiet environment, you can use those techniques of trying to decrease the noise and improving a sleep within the patient to help them decrease these excess immune response or stress responses. So the PNI, as it shows that it has the correlation between stress and inflammation, and it'll help decrease excess immune response, which then will build up or maintain like a balance within the body. As healthcare professionals, we are healers from the start. So our environment, our words, our actions, and our techniques impact and have a direct effect on ourselves and others within the healthcare field, and especially our patients. As an integrative nurse, myself, nurse practitioner, I have learned well-being of a holistic and well-rounded patient-centered care. One great founder in this is Mary J. Kritzer. Our life, our environment, quietness, and sleep are direct effects on how we are with our patients and the health we can give to them. So just like having adequate amounts of sleep, a quiet environment is just as important as your sleep environment. It can have a direct effect on how you're healing. Minimal interruptions, as if you were with patients, low lighting and the environment, limited monitoring of noise, say you're with patients, leads, and things like that, that helps and is part of the healing. So say you are with patients, all of those things in a health environment can really affect how someone heals. Things need to be checked. It's really in your patient's best interest and for yourself to find quiet moments. These are healing and very effective to getting yourself well. So the medical and nursing implementation with the use of PNI. So because we discussed on immune suppression and the response to the patient, just like I talked about sleep and the quiet environment, you can use those techniques of trying to decrease the noise and improving a sleep within the patient to help them decrease these excess immune response or stress responses. So the PNI, as it shows that it has the correlation between stress and inflammation, and it'll help decrease excess immune response, which then will build up or maintain like a balance within the body. As healthcare professionals, we are healers from the start. So our environment, our words, our actions, and our techniques impact and have a direct effect on ourselves and others within the healthcare field, and especially our patients. As an integrative nurse, myself, nurse practitioner, I have learned well-being of a holistic and well-rounded patient-centered care. One great founder in this is Mary J. Kritzer. Our life, our environment, quietness, and sleep are direct effects on how we are with our patients and the health we can give to them. So epigenetics. Now what is epigenetics? That is the study of genes and the heritable changes in the gene expression without changing the actual structure of the DNA. Now I have placed a link here called http://learn.genetics.utah.edu, and I've shown it just a picture of here, and it has a video on what the genetics are and how to learn epigenome. You can catch that at some later time, but basically in the video it's talking about we cannot change the structure of DNA, but surrounding the DNA they're called histone epigenomes, and the DNA is fixed, right? But the epigenome surrounding it is actually pliable, and it can be either very rigid or it can be very soft and flexible, and has found that your environment and the things that you put in your body can have an effect, such as diet, the stress, walking, exercise. And by affecting different points of wellness within your body, you may be able to affect these genes from either turning on or decreasing and managing them on a daily basis. And this is pretty profound and amazing because what you do has an effect on your body. Dr. Lipton has some wellness centers, and he talks about more of the epigenetics, and you can look at other online what is epigenetics, or the CDC has a big information on health and the genome, and there was projects on that. And one of my professors, Dr. Sally Porter at Rutgers, she's really big into and genome, so it's quite interesting if you want to learn more. The body is not in harmony when the mind is imbalanced. Quiet and happy minds make the whole body happy. Another tool to help with implementing ways for the immune response is trying to figure out a way to take care of yourself. I call it the self-care heart bank. Give yourself a quarter to love yourself, a quarter to love the world, a quarter to love life, and a quarter to just reset. So what is mindfulness and how does it affect the PNI system? As we were speaking about the phase 2, and it had shown through studies that mindfulness is in a very effective way in helping build up resiliency and management of these stressors and immune response. Mindfulness is considered an awareness and point of attention in the present moment without judgment, able to feel acceptance, understanding the reaction within the body, trying to find ways of observing patterns, giving yourself a steadiness and practice each and every day. And my disclaimer to everyone is, I am still in practice every day, a work in progress. One of the last slides I want to share with you is meditation and the brain waves. So when you're first talking about mindfulness, you're bringing down an awareness and a relationship, and then we had discussed on how breath work and resetting the brain pattern can we help with overall healing and decreasing and management of these different things within the body. And within meditation, there are brain waves that can bring on certain responses. You have pattern table here. It's called the gamma, the beta, the alpha, theta, and delta. Now in the gamma phase, the Hertz sound within the brain waves is when you're kind of hyper, you're learning, you're stimulated. You may even be overstimulated. In this PNI response, the gamma is almost always on, and you're always working, always thinking, always stimulated. And the process of meditation and mindfulness and like effective breathing is helpful to help bring down this state more and more. Now the beta state is hertz between 13 to 30 hertz, and this functions more of like your everyday, just being kind of alert. This is the working mind, the thinking mind, a little bit of analytical. Every day for the most part, you're between the brain waves and with the beta. Pretty active and excited. And again, if you're like this all the time and you don't go down into more of an alpha or theta phase, you then find yourself in an imbalance. Then you've got the alpha phase, more relaxed. It's kind of in that homeostatic spot. The best areas that you want to be is relaxed and at sleep, or in some way giving your body each of these patterns, but not in excess. So the alpha state is 9 to 13 hertz, and this is when the body kind of slows down. It's the thinking mind. You feel more calm, peaceful, and grounded. We often call this the alpha state. This is like usually how you feel after a yoga class. Now the theta state is between 4 and 8 hertz, and it's like a beginning meditation, verbal thinking, visualization. And then the delta state is usually in that sleep and REM sleep, reactive eye movement. And in this area, usually the most delta thinkers are the Tibetan monks or those that meditate on a very regular basis. But even if you can get yourself into these different patterns or just calmness or mindful moments, that in itself will help relieve a lot of these, or just help alleviate some and manage some of these responses within the body. Close your eyes and think of a place you find real beautiful and yourself beautiful. Let yourself smile as you picture this comforting place in your mind. While you're picturing your beautiful place, be aware of your breathing. Take a deep breath in, take a deep breath out. Keeping the picture in your mind, relax more deeply. Still aware of your breathing, begin to walk into the place you've pictured. For me, that is and walking on the sand. Walk until you've come upon a place you'd like to stop and sit down. Imagine yourself sitting in this place of beauty. Notice the area around you. Is it what makes your place so lovely to you? Each detail adds to the picture of beauty in your mind. You are part of this beauty. Sit still and feel the peace, the strength within. The peace of being part so much beauty. Let your mind think of how right it is that there is so much beauty within you and peace within the world. Picture yourself as you've created this beautiful place in your mind. Continue breathing, inhaling through the nose, exhaling through the nose. And in every breath, relax a little bit deeper into the scene in which you have pictured. Feel the calm, serenity, as long as you like with each and every breath. For me, it's the ocean waves as I feel the calmness and the waves breathing in my breath and exhaling as the waves go out into the ocean. Your breath is unrestrained. As your breathing has been unrestrained, you take a nice inhale through the nose and exhale through the mouth. This is the time when you're sitting in that place of peace and you're relaxing your toes and your feet. You're wiggling out your ankles and bringing a little softness in the knees. Observing the leg muscles as they may have been tense and now they release. And with each and every breath, you're in more deeper and deeper relaxation. You feel your arms a little heavier. Your fingertips may close and then open and release the hands. You loosen up the wrists and the elbows. You are relaxed and you are at peace. Your breath is slow. Your feet and your legs become heavy and warm. You feel your hands and your warm legs are heavy, your arms are heavy. Each simple breath comes and goes. You take this time to center your breathing and your grounding. That is meaning you press those sits bones down into the chair or the floor. With every breath, you think of it coming down from the earth all the way through the center of your body to your heart, out to the crown of your head, and letting go of tension as your body falls into a state of peaceful bliss, Unclench the jaw. Give a space between the teeth with every breath. Soften the face. Release the tongue from the palate. Observe your heartbeat with every breath in a serenity and steady pace. Your breath brings you peace, strength, and relaxation. All those moments and thoughts in your mind, they'll come, they'll go, but bring more of a emptiness void so that your thoughts can go and hide and you are just at peace. Bring a hand to your abdomen and bring some warmth through the breath and let it soften. Now at this time, all of your limbs are heavy and warm, and you are just here right now in your breath. Watch your thoughts come and go like clouds in the sky. Your hands are warm, you're full, your breathing is deep and relaxed. Feel your breath sink lower and lower into your lungs. As your shoulders drop up and back, feel the breath fill up the upper part of the lungs, and then filling up the middle part of your lungs, and your last breath completely filling up those lungs. Each and every moment you are at more peace and more strength within. Your breath has brought you a deep and relaxed state. Your arms and hands are warm. Your forehead is cool. Your lungs are emptied, but then they breathe in full and beautiful breath. You hear the silence grow in your mind as it is quiet and hushes. You are relaxed, calm, and centered. Your heart and breath are calm and steady. Warm hands cool the forehead. Your breath is deep, and you feel in bliss. When you know it's time to leave that place of serenity, you begin to return back into the room or this moment. Let your breath bring you back. Take a couple gentle breaths from the bottom of the ribs, from the side body, mid-chest and upper chest, taking a couple nice, strong, deep breaths in. Pausing for a moment. Remember one last time that you can return to this place anytime you wish. You can get back to this place of serenity and peace at any moment that you feel you may need. Let this feeling come across you and let it be a reminder of your way of finding peace and strength within. Wiggle the toes, the fingers, and bring a little bit more circulation back into the body, some awareness. Take a moment, open up your eyes, feel the goodness and the sanctity and the love within yourself for doing this few minutes of meditation. May the light shine within you each and every day. Namaste. Just remember, if you don't take care of your body, where will you live? Take care of yourself. Be mindful. Give yourself a little bit of breath and give yourself a pat on the back for taking the time for yourself each and every day. Have a wonderful evening or whatever time it is for you. Bye-bye.